More confirmed measles cases in Kansas, now up to 32 confirmed cases across the state. The Kansas Department of Health and Environment also shows most of the affected counties saw a drop in vaccination rates among school-aged children. KDHE's Lily O'Brien joins us with a deeper look at how public health leaders and parents are responding. Lily.
Chris, national data from the Center for Disease Control shows this year's measles cases more than double the total number of cases from 2024, and it's only April. Some people remain on the fence, though, about getting a vaccine to prevent the disease, despite growing concerns from both the medical community and one of the country's most well-known vaccine skeptics. With confirmed cases of measles in more than half a dozen Kansas counties, so is a dip in children receiving vaccines required for school entry. The state of Kansas requires a handful of vaccines for kindergartners to start school. But over the years, vaccination rates have dipped below herd immunity.
That may have been also affected by the distrust and uncertainty with COVID being so novel and everything changing. As religious exemptions have loosened up, the rate of vaccine has been decreasing.
Gray County is one of the southwestern Kansas counties with cases of measles. Between the 2019, 2020, and 2023-2024 academic school years, MMR vaccine rates dropped from 94% to 66%. Sedgwick County's health director Adrian Byrne says the consequences go beyond just the physical symptoms.
21 days is needed to go through 2 cycles of incubation.
Most of the confirmed cases of measles have been in children, so an infection means going almost a month without school. Still, some parents are wary of the shot, like one Sedgwick County mom, Kristen.
I think if you ask one question about it, they're like, you're a crazy anti-vaxxer. I think there's a stigma of it. I think you're not supposed to ask questions. You're just supposed to do what they say.
In a surprising move, longtime vaccine skeptic and Secretary of the Department of Health and Human Services, Robert F. Kennedy Jr., took to the social media platform X to encourage people to get the vaccine. He says the most effective way to prevent the spread of measles is the MMR vaccine.
I think that the numbers are telling that it's easy to say that the measles vaccine doesn't work when you don't have outbreaks in areas around the country. But as that has been occurring, the data speaks for itself.
The Sedgwick County Health Department has hosted multiple vaccine clinics to proactively fight against the disease as it makes its way through Kansas. She says around 70 people have gotten a shot, and Byrne also says measles isn't like the flu or COVID and doesn't appear every year. And while it's rare, she says it's dangerous, contagious, and growing in its presence in Kansas. In studio, Lily O'Brien, KDHE News on your side.